Welcome to Chapter 1, International Healthcare Accreditation. This comprehensive guide will navigate you through globally recognized standards of quality, safety, and compliance in healthcare facilities. Welcome to this CDG training course on Healthcare Facilities International Accreditation Specialist. In today's global healthcare environment, quality, safety, and compliance are not optional. They are essential for trust and survival. This course will guide you through internationally recognized accreditation systems that define excellence in healthcare delivery. Healthcare accreditation is a formal process where an independent body evaluates a healthcare organization against predefined quality and safety standards. It ensures that hospitals, clinics, and healthcare facilities consistently deliver safe, effective, and patient-centered care. Across countries, accreditation acts as a universal benchmark for healthcare quality. Patients, governments, and insurers rely on accreditation to identify trustworthy healthcare providers in an increasingly globalized medical landscape. Healthcare accreditation has evolved from basic hygiene checks to complex systems covering patient safety, risk management, and clinical outcomes. Modern frameworks now integrate technology, data analytics, and continuous improvement models. The primary goal of accreditation is to improve patient outcomes by enforcing consistent standards. It also enhances organizational efficiency, reduces errors, and builds public confidence in healthcare institutions. Understanding the distinction between accreditation and certification is essential for healthcare professionals navigating quality frameworks. Both contribute to quality, but they serve different scopes and purposes within a healthcare organization. Medical tourism, international patient mobility, and cross-border healthcare services have dramatically increased demand for accredited hospitals. Patients often choose facilities with recognized accreditation for assurance of quality and safety. Accreditation frameworks place patient safety at their core. Key safety goals include infection control, medication safety, surgical accuracy, and fall prevention, ensuring comprehensive protection for patients. Accreditation helps identify operational risks and system failures before they impact patients. It promotes proactive risk management rather than reactive problem solving, ensuring safer healthcare environments. The nature of accreditation varies significantly by country and context. Understanding whether accreditation is mandatory or voluntary shapes how healthcare organizations operate and compete globally. Accreditation involves multiple stakeholders, each playing a distinct role in maintaining quality and accountability across the healthcare ecosystem. Patients, regulators, insurers, and accreditation bodies all contribute to this process. Accreditation systems are built on structured components that ensure quality assurance is repeatable, measurable, and continuously improving. Standards, measurable elements, audits, and continuous monitoring work together to create a robust process. Joint Commission International (JCI) is one of the most recognized global accreditation bodies. Hospitals accredited by JCI follow strict international standards for patient safety and care quality, exemplifying excellence in healthcare. Accreditation is not just a checklist. It builds a culture of safety, accountability, and continuous improvement within healthcare organizations. It encourages staff at every level to follow best practices consistently. Healthcare facilities often face significant challenges on the path to accreditation. However, structured training and planning can overcome these barriers effectively, ensuring sustained commitment to quality standards. Accreditation improves professional credibility and opens career opportunities. It ensures healthcare professionals are trained to meet global standards and are recognized for their commitment to excellence. Patients are the ultimate beneficiaries of healthcare accreditation. In accredited facilities, patients receive safer care, better communication, improved outcomes, and greater trust in their healthcare providers. Modern accreditation systems are increasingly powered by digital tools that streamline audits, documentation, and performance tracking. Technology enables real-time monitoring and faster compliance cycles. A hospital in Singapore improved patient safety scores significantly by implementing JCI accreditation standards. The results were measurable and compelling, showcasing real-world improvements, not just compliance on paper. Healthcare accreditation is the foundation of safe, high-quality, and globally trusted healthcare systems. It aligns organizations with international best practices, protects patients, empowers professionals, and drives continuous improvement. Accreditation is crucial in global healthcare systems, ensuring quality and safety across borders. Explore how accreditation ensures safe and reliable patient care worldwide through global connectivity and consistent standards. Patients expect high-quality care globally, driven by informed decisions, medical tourism, and universal quality demands. Standardized accreditation provides a common language for quality, ensuring consistent care worldwide. Accreditation builds patient trust through visible credibility, informed decisions, and long-term loyalty. Countries attract international patients through accredited hospitals, ensuring safety and quality care. Accreditation improves clinical outcomes by reducing complications and enhancing recovery rates. Standardized protocols reduce medical errors, enhancing patient safety and care quality. Accreditation strengthens healthcare systems by building structural resilience and efficiency. Governments integrate accreditation into policies to ensure accountability and quality in healthcare. Accredited hospitals gain a competitive edge, attracting more patients and partnerships. Insurance companies prefer accredited hospitals, reducing financial risks and enhancing policyholder confidence. Accreditation fosters workforce development through continuous training and performance evaluation. Accreditation ensures accountability and transparency through measurable performance indicators. Integration with technology makes accreditation more efficient and data-driven. Accredited hospitals are better prepared for crises, ensuring rapid response and resilient recovery. Accreditation ensures ethical patient care, promoting fairness and informed decision-making. Global benchmarking drives continuous improvement and innovation in healthcare systems. Accreditation supports sustainable healthcare systems, fostering long-term development and resilience. India's success story highlights the impact of accreditation on patient inflow and trust. Accreditation strengthens systems, improves outcomes, and builds global trust, emphasizing its strategic importance. In this chapter, we dive into the major international accreditation bodies that define global healthcare standards. Understanding these organizations is crucial as they shape how hospitals operate, deliver care, and ensure patient safety worldwide. This chapter introduces you to the most influential international healthcare accreditation bodies. These organizations set benchmarks for quality and safety, evaluate facilities, and drive excellence in patient care and operations globally. Accreditation bodies are independent organizations that develop standards and evaluate healthcare facilities. They ensure hospitals meet strict criteria related to quality, safety, and operational efficiency, supporting ongoing improvement and re-evaluation. These organizations operate across multiple countries, influencing healthcare policies globally. Their standards are often adopted by national systems, creating a ripple effect that elevates care quality far beyond individual institutions. Joint Commission International, based in the United States, is a prestigious accreditation body focusing on patient safety, clinical quality, and risk reduction. It is the gold standard for internationally recognized healthcare excellence. JCI standards are comprehensive and demanding, requiring hospitals to demonstrate measurable compliance across various clinical and operational domains to achieve and maintain accreditation. Accredited by JCI, hospitals report measurable improvements in clinical outcomes and patient experience. This makes JCI a preferred choice for facilities focused on international patient care and medical tourism. NABH is India's leading healthcare accreditation body, aligning closely with international standards while addressing local healthcare realities. It covers a wide range of facilities, ensuring quality care delivery. NABH provides a comprehensive framework covering all critical dimensions of hospital operations. It is widely recognized across India and is gaining international recognition as a mark of quality. ISO develops global standards across industries, including healthcare. Its unique approach focuses on process orientation, making it ideal for administrative and support functions within hospitals. ACHSI provides accreditation services globally, emphasizing continuous quality improvement and patient-centered care. It fosters a culture of excellence by bringing Australian healthcare standards to facilities worldwide. ACHSI uses a structured evaluation model focusing on safety, quality, and performance outcomes. It encourages healthcare organizations to continuously improve, embedding quality improvement into the organization's DNA. Each accreditation body brings a distinct philosophy and focus. Understanding these differences helps healthcare leaders make informed decisions about which standards best align with their organizational goals. Healthcare facilities choose accreditation based on strategic goals, patient demographics, and market positioning. There is no single right answer. The best choice depends on context. Some hospitals pursue multiple accreditations to strengthen credibility, broaden recognition, and demonstrate comprehensive commitment to quality. This approach creates a robust quality ecosystem within the facility. Accredited hospitals gain recognition within international healthcare networks, opening doors to partnerships, collaborations, and research opportunities that would otherwise be inaccessible. While accreditation delivers significant benefits, the journey is not without complexity. Healthcare organizations must carefully plan their accreditation strategy to navigate these challenges effectively. Proper training is essential to understand and implement accreditation standards effectively. CDG training emphasizes structured, practical learning to help healthcare professionals navigate these complex frameworks with confidence and competence. A multi-specialty hospital in Dubai achieved both JCI and ISO certification, demonstrating how integrated accreditation strategies can transform operational performance and international reputation. Understanding global accreditation bodies empowers you to choose, implement, and manage the right standards for healthcare excellence and international credibility. Pursue excellence through strategic alignment and investment in training. Explore how accreditation standards and measurable elements ensure compliance in healthcare settings, providing a comprehensive guide to quality standards. In this chapter, discover how accreditation standards define safe and effective care, their structure, and how they ensure compliance in healthcare. Accreditation standards are essential requirements for healthcare facilities, covering clinical care, patient safety, infrastructure, and organizational processes. Standards ensure consistency, reduce variation, and promote reliable, high-quality patient care across all departments and facilities. Healthcare standards are divided into clinical, administrative, and support services, each addressing specific aspects of healthcare operations. Measurable elements are criteria used to assess compliance with standards, transforming abstract standards into objective, accessible criteria. Measurable elements enhance audit accuracy and consistency, ensuring transparent and reliable compliance assessments in healthcare. Each standard includes a statement, intent, and measurable elements, ensuring clarity and ease of implementation across healthcare settings. Clinical standards focus on patient care processes like diagnosis, treatment, and monitoring, ensuring evidence-based practices are followed. Administrative standards address leadership, governance, and policy management, ensuring effective organizational control and accountability. Support standards include housekeeping, waste management, and facility maintenance, crucial for a safe and hygienic healthcare environment. Accreditation bodies assign scores based on compliance with measurable elements, with facilities needing to meet minimum thresholds for accreditation. Auditors rely on documented evidence, observations, and interviews to ensure compliance is demonstrated through verifiable proof. Compliance is an ongoing process, with facilities needing to continuously monitor and improve performance to maintain standards. Gap analysis helps identify areas needing improvement before audits, transforming vague goals into specific, actionable priorities. Facilities often face challenges with documentation, staff training, and process consistency, which are crucial for successful accreditation. Leadership is vital in implementing standards, ensuring accountability, resource allocation, and aligning goals with the organization's mission. Digital systems enhance compliance tracking and evidence storage, providing real-time insights and supporting quality improvement planning. Hospitals implement measurable elements through SOPs, staff training, and checklists, ensuring consistent execution and improved outcomes. A German hospital improved audit scores by implementing measurable elements, achieving faster accreditation and significant score improvements. Standards define expectations, while measurable elements ensure accountability, equipping professionals to apply both effectively in practice. Welcome to Chapter 5, where we delve into patient-centered care and safety goals, crucial components of healthcare accreditation. Patient-centered care is the foundation of modern healthcare, focusing on the needs and safety of patients. This chapter will guide you through its principles and real-world applications. Patient-centered care emphasizes respect, dignity, and patient involvement in decision-making, ensuring care aligns with individual needs and values. The core principles of patient-centered care include respect, communication, emotional support, and family involvement, creating a holistic care environment. Accreditation emphasizes patient-centered practices, impacting standards compliance, satisfaction scores, and clinical outcomes. Patient safety goals are specific objectives to reduce risks and prevent harm, forming the backbone of safe clinical practice. Common safety goals include correct patient identification, medication safety, and effective communication, ensuring comprehensive patient safety. Implementing safety goals reduces medical errors and complications, leading to improved recovery rates and patient satisfaction. Patient identification protocols, such as two-factor verification and wristband checks, prevent misidentification and enhance safety. Medication safety practices focus on the 5 rights, barcode scanning, and double-check protocols to prevent errors. Infection prevention measures like hand hygiene, sterilization, and PPE compliance protect both patients and healthcare workers. Effective communication in healthcare, using frameworks like SBAR, prevents errors and improves coordination. Technology plays a crucial role in patient safety, with electronic health records and clinical decision alerts enhancing care quality. Measuring patient experience through surveys and feedback systems is essential for improving care quality. Emotional and psychological support are vital for patient recovery, with dedicated services improving satisfaction and reducing hospital stays. Family involvement in care enhances decision-making and planning, leading to better outcomes and stronger patient trust. Cultural sensitivity in healthcare improves patient trust and outcomes, with language access and bias awareness training being key components. Implementing patient-centered care faces challenges like staff workload and communication gaps, requiring structured systems and training. Continuous improvement in patient care involves measuring feedback, analyzing root causes, and implementing improvements. A UK hospital's case study shows significant improvements in complaints and satisfaction through structured communication and safety protocols. Key takeaways include knowing the principles, applying the goals, and driving improvement to make patient-centered care a reality. Welcome to Chapter 6, where we delve into the crucial roles of clinical governance and leadership responsibility in healthcare. This chapter is part of the Professional Healthcare Leadership series, designed to enhance your understanding and skills in these vital areas. In this chapter, you'll explore how clinical governance ensures accountability and quality in healthcare systems. It provides a structured framework for organizations to continuously improve patient care, equipping professionals with the tools needed for effective governance. Clinical governance is a system ensuring healthcare organizations maintain and improve service quality. It integrates leadership, policies, and clinical practices to enhance patient safety, with structured accountability and continuous improvement at its core. Clinical governance includes key components like quality assurance, risk management, clinical audits, and staff training. These elements work together to improve healthcare outcomes and ensure patient safety across the organization. Leadership is vital in driving quality and safety initiatives. Effective leaders set clear expectations, allocate resources, and ensure compliance with standards, fostering an environment where patient care thrives. Clear accountability at all organizational levels is essential. When embedded into the culture, it leads to better reporting and prevention of errors, with strong frameworks consistently outperforming peers in safety metrics. Strong leadership promotes a culture where safety is prioritized over convenience, leading to measurable reductions in adverse events. This trend highlights the importance of leadership in enhancing patient safety outcomes. Effective decision-making relies on data, evidence, and collaboration. Leaders use clinical data to guide improvements, ensuring decisions are grounded in measurable outcomes rather than assumptions. A safety culture encourages error reporting without fear, focusing on learning and improvement. It fosters an environment where staff feel empowered to speak up, enhancing overall safety and quality. Clinical audits evaluate whether healthcare services meet standards, identifying gaps and improving performance. They involve defining standards, collecting data, comparing results, and implementing changes. Integrating risk management into daily operations ensures potential issues are identified early. This proactive approach prevents escalation into serious safety events, enhancing overall clinical governance. Healthcare organizations track performance using key indicators to measure effectiveness and identify improvement areas. Consistent monitoring enables timely interventions and strategic planning. Continuous training ensures staff remain competent with the latest clinical practices. It reduces errors from outdated practices and builds confidence, directly impacting patient safety. Clear communication between leadership and staff ensures alignment across the organization. It reduces errors, improves coordination, and creates a shared understanding of goals and expectations. Ethical leadership upholds standards in patient care and decision-making. It builds trust within the organization, ensuring integrity, fairness, compassion, and accountability in all governance decisions. Implementing clinical governance faces challenges like resistance to change and limited resources. Overcoming these requires strong leadership, strategic planning, and a commitment to continuous improvement. Policies provide clear guidelines for clinical and administrative actions, ensuring consistency and compliance. Well-written policies are effective only when staff are trained and leaders model compliance consistently. Clinical governance promotes ongoing improvement through feedback and audits. It ensures systems evolve with changing patient needs and regulatory expectations, driving sustained improvement. Leaders ensure compliance with accreditation standards through structured accountability frameworks. This involves defining responsibilities, monitoring compliance, reviewing performance, and reporting to the board. A hospital in Canada improved safety outcomes by implementing strong governance and leadership accountability systems. This transformation led to reduced clinical errors and improved staff performance. Clinical governance and leadership responsibility are essential for safe, high-quality healthcare delivery. CDG training equips you to implement these principles effectively, ensuring every patient receives safe, high-quality care. Welcome to Chapter 7, where we delve into the crucial aspects of risk management and incident reporting systems in healthcare. This training is designed to enhance safety and quality improvement. Risk management is vital for protecting patients, supporting staff, and strengthening organizations. By identifying risks early, we ensure safer and more effective care delivery. In healthcare, risk management involves identifying, assessing, and controlling potential hazards. It's about preventing incidents before they occur, ensuring a safe environment for everyone. Healthcare risks are diverse, including clinical, operational, environmental, and administrative issues. Each type impacts patient safety and organizational performance. Effective risk management reduces patient harm and improves care quality. It also protects organizations from legal and financial consequences, ensuring sustainability. Risk identification involves observing processes, reviewing data, and gathering feedback. This helps uncover vulnerabilities that might not be apparent in daily operations. Once identified, risks are analyzed based on likelihood and impact. This prioritization helps direct resources where they are needed most, ensuring effective mitigation. Control strategies include policies, training, and technology to minimize incident chances and reduce harm severity. These measures are essential for maintaining safety. Incident reporting systems capture information about errors and near misses, providing valuable data for improving safety and preventing future occurrences. Incidents like patient falls, medication errors, and equipment failures must be documented and analyzed to prevent recurrence and improve safety. A healthy reporting culture encourages staff to report incidents without fear, leading to better learning and prevention across the organization. Root cause analysis helps identify the underlying causes of incidents, enabling lasting improvements by addressing systemic issues. Continuous monitoring ensures risks remain under control, allowing for timely updates to strategies based on new data and emerging threats. Technology plays a crucial role in risk management by enhancing accuracy and efficiency, enabling timely responses to emerging risks. Compliance with legal and regulatory requirements is essential to avoid penalties and ensure patient trust and safety. Training equips staff to identify and report risks, building confidence and competence in handling incidents effectively. Effective communication ensures risks are shared across departments, promoting coordinated action and prevention. Risk management supports continuous quality improvement, ensuring organizations remain responsive to challenges and opportunities. Leadership is key in risk management, providing resources and support to build a culture of safety and accountability. A case study from Australia shows how structured reporting and training significantly reduced patient falls and improved staff compliance. Key takeaways emphasize the importance of early risk identification, incident reporting, and leadership commitment in enhancing healthcare safety. Welcome to Chapter 8, where we delve into infection prevention and control standards. This training is crucial for building safer healthcare environments through evidence-based practice. In this chapter, you'll learn how infection prevention and control standards protect patients, staff, and healthcare environments. Healthcare-associated infections are a major risk, making IPC a critical component of accreditation. IPC encompasses policies and procedures designed to prevent infections in healthcare settings. It includes hygiene practices, sterilization, and patient isolation to safeguard both patients and staff. Effective IPC reduces hospital-acquired infections, improves recovery rates, and enhances patient safety. It also protects staff from occupational hazards and reduces financial burdens from extended hospital stays. Healthcare-associated infections can arise from various sources. Understanding each type is essential for targeted prevention. Common infections often result from poor hygiene, inadequate sterilization, or lapses in precautions. Infections spread through contact, droplet, airborne, and fomite pathways. Each requires specific precautions, from hand hygiene to PPE and surface disinfection, to prevent transmission. Hand hygiene is the most effective method to prevent infection spread. The 5 Moments for Hand Hygiene framework provides a global standard for when and how to perform hand hygiene. Data shows that higher hand hygiene compliance directly correlates with lower infection rates. Monitoring compliance is crucial for maintaining effectiveness over time. PPE forms a barrier between healthcare workers, patients, and infections. Proper selection and use of gloves, masks, gowns, and face shields are vital for protection. Proper sterilization of medical equipment prevents cross-contamination. Methods like autoclaving, chemical disinfection, and UV sterilization ensure a safe clinical environment. Isolation protocols prevent the spread of pathogens by identifying, isolating, protecting, and monitoring patients with infectious diseases. These are key to infection control. Improper disposal of biomedical waste can trigger serious infections and legal risks. Proper waste management is crucial to prevent occupational infections in healthcare settings. Regular cleaning of all surfaces is essential to prevent infection transmission. High-touch areas require frequent disinfection to maintain a safe environment. Hospitals track infection rates to measure IPC effectiveness. Data analysis helps identify trends and improve interventions, especially in high-risk departments. Digital systems enhance infection control by tracking data, generating real-time alerts, and improving monitoring accuracy. Technology plays a pivotal role in IPC. Comprehensive training ensures staff follow correct IPC practices. Regular updates keep personnel informed about new risks and best practices, enhancing overall safety. IPC programs face challenges like staff non-compliance, resource limitations, emerging diseases, and leadership gaps. Addressing these is crucial for sustained effectiveness. IPC systems must adapt to new risks and environments. Continuous improvement is an ongoing commitment, requiring investment in training, technology, and leadership. Effective leadership is vital for IPC success. Leaders ensure policy implementation, resource allocation, and performance monitoring, maintaining robust infection control standards. A hospital in South Korea achieved a 40% reduction in infection rates through comprehensive IPC overhaul. Strong leadership, technology, and a culture of improvement were key factors. Infection prevention and control standards are essential for safe healthcare environments. Training, leadership, and accountability empower staff and drive improvement. Welcome to Chapter 9 of the COG training series, focusing on medication management and patient safety protocols. This chapter is crucial for ensuring safe and effective patient care. In this chapter, you'll explore how structured medication management systems prevent errors and enhance patient treatment. Medication errors are a significant risk in healthcare, making structured protocols essential. Medication management involves prescribing, dispensing, administering, and monitoring medications to ensure patients receive the correct treatment safely and effectively. Each step is vital for patient safety. Medication safety is key to quality healthcare, reducing adverse events, improving outcomes, and meeting accreditation standards. It is a cornerstone of patient care and healthcare organization success. The medication process is a carefully controlled sequence of steps to prevent errors. Each stage, from prescribing to monitoring, is a critical safety checkpoint to ensure patient safety. Understanding medication errors is crucial for prevention. Errors can occur at any stage, leading to significant patient harm. Awareness is the first step in preventing these errors. Medication errors have severe consequences, including extended hospital stays, increased costs, and elevated patient risk. They represent a heavy burden on patients and healthcare systems alike. Accurate prescribing is the first line of defense in medication safety. Electronic prescribing, clear instructions, allergy checks, and drug interaction reviews are essential practices. Pharmacists are critical in medication safety, verifying prescriptions, screening for interactions, and providing patient counseling. They act as safety guardians in the medication process. Proper storage is vital for medication effectiveness and safety. Temperature control, light protection, secure access, and expiry monitoring are key standards to maintain. High-risk medications require additional safeguards due to their potential for serious harm. Proper labeling and handling are crucial to prevent errors in their administration. The 5 Rights framework ensures safe medication administration. Correct patient, drug, dose, time, and route are essential to prevent errors and ensure patient safety. Technology plays a transformative role in reducing medication errors. From electronic prescribing to automated dispensing, digital systems enhance safety at every step. Systematic tracking and reporting of medication errors are essential for safety. Incident reporting, root cause analysis, and feedback loops help identify and address issues effectively. Patients are active partners in medication safety. Encouraging open communication, providing education, and ensuring medication reconciliation are key to involving patients in their care. Training is crucial for a competent workforce in medication management. Regular updates, competency assessments, and simulation-based learning ensure staff are well prepared. Healthcare organizations face challenges like high workload, communication gaps, complex drug interactions, and system fragmentation. Recognizing these barriers is the first step to addressing them. Continuous improvement involves measuring, identifying, implementing, and evaluating changes to reduce medication errors. It's an ongoing journey towards safer healthcare practices. Leadership is vital for effective medication safety. Policy development, resource allocation, performance monitoring, and accountability culture are key leadership responsibilities. A U.S. hospital successfully reduced medication errors by 60% through key interventions like barcode scanning and electronic prescribing. This case highlights the impact of technology and leadership. Medication management and safety protocols are essential for preventing harm and ensuring effective treatment. COG training equips you to implement these systems with confidence. Welcome to Chapter 10, where we explore the critical aspects of facility safety, environment, and infrastructure compliance in healthcare settings. This foundation is essential for delivering safe healthcare services. In this chapter, you'll learn how facility safety and infrastructure compliance are vital for safe healthcare delivery. A well-maintained environment enhances patient outcomes and staff efficiency. Facility safety ensures a secure and functional healthcare environment. It covers everything from building design to emergency preparedness, ensuring a hazard-free setting. Infrastructure compliance is crucial for meeting regulatory standards and reducing risks. It supports certification and protects patients and staff from harm. Facility safety involves multiple components like fire safety, electrical systems, HVAC, and building structure, all working together to ensure a safe environment. Fire safety systems, including detection, alarms, and evacuation drills, are essential for protecting patients who may be unable to evacuate independently. Reliable electrical systems are vital for life-saving equipment. Backup generators and UPS ensure continuous power supply during outages. Infrastructure failures can disrupt services. Facilities with preventive maintenance see a significant reduction in incident rates compared to those without. Proper ventilation reduces infection risks and maintains air quality. HVAC systems must be regularly monitored to ensure optimal conditions. Safe water supply and sanitation are critical for preventing contamination and infection spread, making them a compliance area. Regular inspection and maintenance of medical equipment ensure accuracy and safety, protecting patients and staff from equipment-related harm. Hospitals must manage hazardous materials safely, with proper storage, handling, and disposal to prevent accidents and contamination. Effective safety signage and navigation help guide patients and staff, reducing confusion and improving emergency response times. Monitoring facility performance with KPIs helps identify maintenance needs and improve operational efficiency, moving from reactive to proactive management. Preventive maintenance keeps infrastructure functional and compliant, reducing unexpected failures and extending asset lifespan. Hospitals must be prepared for disasters with comprehensive emergency plans to protect patients, staff, and critical operations. A safe physical environment reduces patient injuries and supports overall care quality. Thoughtful design plays a key role in safety. Facility managers face challenges like aging infrastructure and budget constraints. Understanding these challenges is the first step to overcoming them. Leadership in facility safety involves setting culture, allocating resources, monitoring performance, and driving improvement across the organization. A case study from Japan shows how targeted infrastructure investment can lead to measurable improvements in safety and reliability. Safe facilities lead to better outcomes. Understanding, implementing, leading, and improving safety systems are key to protecting patients and staff. Welcome to Chapter 11, a comprehensive guide to accurate documentation, medical records management, and data integrity in modern healthcare systems. This chapter will equip you with essential knowledge to ensure the highest standards in healthcare documentation. In this introduction, we explore how accurate documentation in medical records form the backbone of safe and effective healthcare systems. Every clinical decision, treatment, and outcome must be properly recorded to ensure continuity of care and compliance with accreditation standards. Healthcare documentation encompasses all records related to patient care, treatment, and clinical decisions. It serves as a legal, clinical, and operational record, providing evidence of care delivered, supporting diagnosis and treatment planning, and ensuring efficient management of healthcare services. Medical records are crucial for ensuring continuity of care across departments, supporting informed clinical decisions, and improving patient outcomes. Accurate and accessible records allow healthcare teams to act faster and more effectively, directly impacting the quality of treatment plans. Medical records include patient history, diagnostic reports, treatment plans, and discharge summaries. Each type of record provides critical information for patient management, ensuring that healthcare providers have a comprehensive understanding of a patient's medical journey. The shift from paper-based systems to electronic health records marks a significant transformation in healthcare. EHRs improve accessibility, accuracy, and efficiency across the entire care continuum, offering a more streamlined and effective approach to managing patient information. EHR systems significantly reduce errors, improve coordination, and enable real-time data access. They enhance overall healthcare quality, with notable improvements in error reduction, faster access, better coordination, and cost savings, making them a cornerstone of modern healthcare quality improvement. Accurate and complete documentation is essential for safe patient care. Incomplete records can lead to misdiagnosis and treatment errors, putting patients at serious risk. Proper patient identification, timely entry, and complete information capture are critical components of effective documentation. Standardized formats ensure consistency across records, making it easier for healthcare providers to understand and use information. Uniform templates, consistent terminology, and regulatory alignment reduce variability and prevent misinterpretation, supporting effective communication and care delivery. Medical records serve as legal documents in disputes or audits, providing evidence of care provided and protecting both patients and healthcare professionals. They are critical in medical legal cases, ensuring audit compliance and liability protection for clinicians. Data integrity ensures that information is accurate, consistent, and secure. It is critical for maintaining trust in healthcare systems and ensuring that clinical decisions are based on reliable data. Accuracy, consistency, and security are the pillars of data integrity. Patient data must be protected from unauthorized access. Confidentiality is a fundamental ethical and legal requirement, with breaches potentially leading to serious legal consequences. Access controls, data anonymization, and legal compliance are essential to safeguarding patient privacy. Technology enables secure storage, retrieval, and sharing of medical data. Advanced systems support data analytics and decision-making, transforming how healthcare organizations manage information. Secure cloud storage, analytics, and seamless data sharing are key components of modern data management. Regular audits ensure documentation meets accreditation standards, helping identify gaps and improve record quality. Scheduling audits, identifying gaps, implementing improvements, and reporting to leadership are essential steps in maintaining high-quality documentation practices. Errors such as missing information or incorrect entries can compromise patient safety. Proper training and robust systems are essential to reduce these risks and protect both patients and healthcare providers. Structured training programs significantly reduce error rates and improve documentation accuracy. Interoperability allows different healthcare systems to share data seamlessly, improving coordination and patient care. By ensuring the right information reaches the right provider at the right time, interoperability eliminates duplication, reduces delays, and ensures a complete picture of the patient's health journey. Healthcare staff must be trained in proper documentation practices to ensure accuracy, consistency, and compliance. Foundation training, EHR system training, and ongoing refresher courses are essential to meet accreditation requirements and improve clinical outcomes. Data management faces challenges like data overload, system integration issues, and security risks. Effective systems and policies help address these challenges, ensuring data remains a reliable asset rather than a liability. Overcoming these challenges is crucial for maintaining data integrity and availability. Leadership ensures strong data governance frameworks and compliance. By setting policies, ensuring accountability, monitoring systems, and driving continuous improvement, leadership plays a crucial role in maintaining data integrity and accountability across all levels of the organization. A hospital in Sweden improved patient outcomes by implementing a fully integrated EHR system with CDG training. This transformation reduced errors and improved efficiency across all departments, demonstrating the impact of the right systems, training, and governance on healthcare outcomes. Accurate documentation and strong data integrity are essential for safe, compliant healthcare systems. CDG training equips you to implement these practices effectively, emphasizing the importance of documenting accurately, protecting data integrity, leading with governance, and continuous training. Welcome to Chapter 12, where we delve into the essentials of staff qualification, training, and competency assessment. This comprehensive guide is designed to help you build and maintain a competent healthcare workforce, ensuring high-quality patient care. In this chapter, you'll learn how staff qualification and competency directly impact healthcare quality and patient safety. A skilled workforce is crucial for delivering consistent, high-quality care in accredited healthcare facilities. Qualified staff are the backbone of effective patient care. Their skills and knowledge form the foundation for accurate diagnosis, effective treatment, and reduced medical errors, ultimately leading to improved patient satisfaction and organizational pride. Competency in healthcare combines knowledge, skills, and behavior to meet high standards of care. These three pillars ensure that healthcare professionals can perform tasks effectively and safely. Healthcare organizations must rigorously verify qualifications, licenses, and experience during hiring. This process ensures that only competent professionals are employed, maintaining patient safety and care quality. Orientation programs are crucial for new employees to understand policies and procedures. A well-structured program reduces early turnover and ensures staff are confident and compliant from day one. Ongoing training keeps staff updated with the latest medical practices, supporting continuous professional development. This ensures the workforce remains capable in an ever-evolving healthcare landscape. Effective workforce development requires diverse training programs tailored to specific competencies. From clinical skills to technology training, each program enhances different aspects of healthcare delivery. Competency is assessed through various methods to ensure a comprehensive view of each staff member's capabilities. Regular assessments maintain consistent quality across the organization. Simulation training allows staff to practice real-life scenarios safely, improving readiness and significantly reducing errors in actual clinical situations. It builds confidence and enhances team coordination. Performance appraisals measure staff effectiveness and identify areas for improvement, supporting career growth and accountability within the organization. They are vital for targeted feedback and development planning. Healthcare professionals must maintain valid certifications and licenses to ensure compliance with regulatory standards. This is crucial for patient safety and avoiding legal liabilities. Leadership is key in supporting training programs and ensuring staff competency. Strong leadership fosters a culture of learning and continuous improvement throughout the organization. Healthcare organizations track competency through performance indicators and structured monitoring systems. This helps maintain high standards of care and enables early identification of issues. Identifying and addressing skill gaps is essential for proactive workforce development. Targeted training programs help bridge these gaps, ensuring each staff member meets the required competencies. Despite its importance, workforce development in healthcare faces challenges like staff shortages and budget limitations. Effective planning and leadership are essential to overcome these obstacles. Communication, empathy, and teamwork are crucial for patient-centered care. Soft skills enhance patient experience and foster effective collaboration among healthcare teams. Healthcare organizations must continuously update training programs to ensure staff remain competent. Improvement is an ongoing journey, not a destination, reflecting a culture of professional development. Structured frameworks ensure consistent and effective training delivery across all departments. This systematic approach aligns with organizational goals, enhancing workforce competency and development. A hospital in Germany improved staff performance through structured competency assessments and targeted training. This case demonstrates the success of CDG-aligned programs in real-world healthcare applications. Staff qualification, training, and competency assessment are essential for delivering safe, high-quality healthcare. CDG training equips you to build and maintain a competent workforce, ensuring continuous improvement. Welcome to Chapter 13, where we explore the vital role of internal audits and continuous quality improvement in healthcare. This training is designed to build excellence through systematic evaluation and ongoing improvement. In this chapter, you'll discover how internal audits and continuous quality improvement ensure healthcare systems remain effective and compliant. These audits are not just inspections, they are powerful tools for identifying gaps and driving improvement. An internal audit is a systematic evaluation of processes and practices within a healthcare facility. It ensures compliance with accreditation standards and organizational policies, supporting rather than penalizing healthcare teams. Internal audits help identify non-compliance, risks, and improvement opportunities. They ensure that standards are consistently followed across all departments, evaluating potential risks to patient safety and organizational integrity. Audits can be clinical, administrative, or operational, each focusing on different aspects of healthcare delivery. This comprehensive coverage ensures quality across the organization. Audit planning involves defining scope, objectives, and timelines. Proper planning ensures effective and efficient audits that deliver meaningful, actionable results. Auditors collect data through observations, interviews, and document reviews. This comprehensive evaluation ensures accuracy and compliance across all relevant departments. Findings are documented and shared with management, highlighting areas of compliance and non-compliance. Clear, accurate reporting ensures leadership can prioritize resources effectively. Corrective actions address existing issues, while preventive actions avoid future risks. CAPA is essential for continuous improvement and long-term compliance sustainability. Continuous quality improvement focuses on the ongoing enhancement of healthcare processes. It ensures long-term improvement rather than one-time fixes, embedding a culture of excellence into everyday practice. CQI is based on data-driven decision-making, teamwork, and continuous monitoring. It promotes a culture of ongoing improvement across every level of the organization. The PDCA cycle is a widely used CQI model, offering a structured approach to implementing improvements. Its iterative nature ensures a continuous spiral of improvement rather than a one-time fix. Healthcare organizations use key performance indicators to track improvement. These metrics guide decision-making and ensure that quality efforts are producing measurable results. CQI improves patient outcomes, reduces errors, and enhances efficiency. It ensures healthcare systems evolve continuously to meet the growing demands of modern patient care. Data collection and analysis are essential for identifying trends and improvement areas. Accurate data supports effective decision-making and ensures that quality initiatives are targeted where they are needed most. All staff members contribute to quality improvement initiatives. Engagement at every level ensures successful implementation and creates a shared sense of ownership over quality outcomes. Challenges include resistance to change, lack of data, and resource constraints. Structured systems and strong leadership help healthcare organizations overcome these barriers effectively. Monitoring systems track progress and ensure improvements are sustained over time. They provide real-time insights into performance, enabling rapid response to emerging issues. Leadership plays a key role in promoting a culture of quality and accountability. CDG training emphasizes leadership-driven quality improvement initiatives that cascade through every level of the organization. A hospital in the Netherlands improved compliance scores through regular internal audits and CQI programs. This structured approach led to enhanced efficiency and patient safety across the organization. Internal audits and continuous quality improvement are essential for sustaining healthcare excellence. CDG training equips you to implement these systems effectively, driving accountability and compliance. Welcome to Chapter 14, where we delve into the accreditation process, surveys, and gap analysis. This chapter is part of COG training, aimed at building excellence in healthcare quality and safety. In this chapter, you'll gain a comprehensive understanding of the accreditation journey from preparation to final approval. Learn how surveys are conducted and how gap analysis drives compliance improvements. This knowledge is crucial for ensuring patient safety and care quality. The accreditation process is a series of structured steps ensuring healthcare organizations meet quality and safety standards. Each phase builds on the last, from application to certification, ensuring no aspect of compliance is overlooked. The accreditation journey is divided into 4 critical stages: preparation, self-assessment, external survey, and certification. Each stage plays a vital role in achieving and maintaining accreditation status. The preparation phase is foundational for successful accreditation. It involves understanding standards, aligning policies, and training staff to ensure everyone is ready for the journey ahead. Self-assessment is a crucial internal process that helps organizations evaluate their readiness before the external survey. It identifies strengths and spots weaknesses, allowing time for corrective action. Gap analysis compares current practices against required standards, highlighting deficiencies that must be addressed before the external survey. It provides a clear roadmap for compliance improvement. Gap analysis is a strategic tool that prioritizes improvements and reduces the risk of non-compliance. Organizations using it report higher compliance rates and improved survey outcomes. Proper documentation is essential for demonstrating compliance during an accreditation survey. All policies, procedures, and records must be meticulously organized and accessible to surveyors. Staff preparation is critical for accreditation success. Training should cover awareness, role-specific preparation, mock interviews, and ongoing reinforcement to ensure confidence and readiness. The external survey is the most visible phase of accreditation. Surveyors evaluate compliance in real time, reviewing documentation and observing operations. Proper preparation is key to success. Tracer methodology is a powerful tool used by surveyors to assess real-time compliance across departments. It follows a patient's journey through the facility, revealing integration into daily practice. Facilities are scored based on compliance with standards. The scoring outcome determines the accreditation status, with transparent feedback provided to support targeted improvement. Understanding common survey findings helps organizations proactively address them. Issues like documentation gaps, process inconsistencies, and training deficiencies are frequently cited. Post-survey actions are critical for continuous improvement. Addressing identified gaps through corrective action plans is essential for maintaining accreditation status. After the survey, a final decision is made regarding accreditation. Whether full, conditional, or denied, the decision provides valuable feedback for continuous quality improvement. The accreditation process timeline varies based on readiness and complexity. Proper planning and early preparation are essential for timely completion of each phase. Accreditation brings challenges like resource constraints and staff readiness. Strategic solutions include establishing a dedicated committee and using gap analysis to focus efforts. Leadership is crucial for accreditation success. Effective leaders set the vision, allocate resources, and ensure cross-departmental coordination to achieve objectives. AUAE Hospital achieved full accreditation on its first attempt by using comprehensive gap analysis and targeted staff training. This case demonstrates that with the right methodology, success is achievable. The accreditation process ensures healthcare organizations meet standards. Key takeaways include following a structured process, using gap analysis, and recognizing the importance of people and guidance from COG training. Welcome to Chapter 15, where we explore the vital role of sustaining accreditation and future trends in healthcare quality. This journey is part of the Healthcare Quality Excellence series, designed to equip you with the knowledge to maintain and enhance healthcare standards. In this chapter, you'll discover how healthcare organizations maintain accreditation and adapt to future quality trends. Achieving accreditation is a milestone, but sustaining it requires continuous effort, monitoring, and improvement. Sustaining accreditation involves consistently meeting standards beyond initial certification. It's an ongoing commitment to excellence, requiring compliance with established standards, continuous monitoring, and regular improvement cycles. Maintaining accreditation ensures patient safety protocols remain effective, enhances organizational reputation, and demonstrates regulatory confidence. It's a commitment to the highest standards of healthcare delivery. Healthcare facilities must regularly monitor compliance to ensure readiness for audits and surveys. Real-time dashboards and alert systems play a critical role in transforming reactive measures into proactive quality management. Internal audits are crucial for sustained accreditation. They help identify gaps, align with accreditation requirements, and ensure continuous improvement through structured reviews and action on findings. Staff engagement is key to maintaining quality practices. Accountability ensures adherence to standards, with team ownership, clear roles, open communication, and a culture of recognition driving sustained engagement. Healthcare organizations track key performance indicators to measure quality across critical domains. These metrics guide improvement efforts and demonstrate sustained compliance to accreditation bodies. Ongoing training ensures staff remain competent and updated with the latest standards. It's essential for sustained compliance and quality improvement, involving needs assessment, program design, and regular evaluation. Digital tools enhance compliance tracking and reporting, making processes efficient and accurate. Technology reduces manual burdens and improves data integrity, supporting sustained accreditation efforts. Patient feedback offers valuable insights into service quality and identifies areas for improvement. Organizations that act on feedback demonstrate a patient-centered approach to sustained accreditation. Risk management is a continuous process, even after accreditation. It ensures ongoing patient safety by identifying and mitigating potential hazards through systematic scanning and evaluation. Healthcare standards evolve with new regulations and priorities. Organizations must adapt quickly to remain compliant, involving monitoring, analysis, updates, communication, and verification of compliance. Future trends include digital audits, AI-driven analytics, and remote monitoring. These innovations are transforming how accreditation processes are conducted and sustained, paving the way for a more efficient future. Data analytics help predict risks and improve outcomes, supporting evidence-based decision-making. This shift from reactive problem-solving to proactive management reinforces the case for data-driven accreditation strategies. Future healthcare focuses on personalized and patient-centered services. Technology enhances patient engagement and experience, making care more responsive, accessible, and effective through digital health apps and remote monitoring. Sustainable practices reduce environmental impact and improve operational efficiency. Green hospitals are becoming a global trend, integrating sustainability into accreditation frameworks worldwide. Healthcare organizations collaborate internationally to share knowledge and standards. This cooperation improves global healthcare quality and accelerates the adoption of accreditation frameworks worldwide. Strong leadership ensures organizations adapt to future trends and challenges. Emphasizing strategic vision, empowering teams, and embracing innovation are key to sustained accreditation success. A Singapore hospital sustained accreditation by integrating AI-based monitoring and continuous staff training. This approach delivered measurable improvements, enhancing patient satisfaction and organizational growth. Sustaining accreditation requires continuous improvement, innovation, and commitment. CDG training equips you to lead healthcare organizations into the future with confidence, emphasizing improvement, innovation, and leadership.